I give the call to the member for Goldstein.
Thank you, Deputy Speaker. Deputy Speaker, it's a privilege to be able to speak on this important legislation around the indexation of thresholds for private health insurance. And I say that because, of course, private health insurance is an integral part of our health system. The members on the other side of this chamber have always had a crusade that they want to destroy private health insurance because it gives everything that they don't want Australians to have. Empowerment to be free, to make choices and to determine their own destiny over their own health care. What the Labor Party has always wanted for Australians is a sense of conformity where they go into a system, they're dictated to, and they have choice removed. And of course, in the end, we know what happens with that. You get conformity through poverty, conformity through the concept of equality to them, which only amounts to poor standards and outcomes. Whereas private health insurance is actually about freeing up capital, about encouraging people to be able to make choices about their health care, to be able to make informed decisions, and of course, if they don't like the state system that is imposed upon them, that they have an alternative. And of course, the long history of this country, Australians forget this, is that private health insurance and mutualism was at the heart of our health system for most of modern Australia. And what happened was people got together, they collaborated through mutuals or insurance pools to be able to provide assistance to each other and to manage out risk. And that system delivered, of course, quality healthcare based on choice and actually ensured that Australians understood the importance of healthcare, but also that healthcare costs. And as soon as, of course, you push that cost further away, the obligation, the sense of responsibility have to it diminishes.
Yeah, sure.
That's very different from, of course, the Goldstein electorate. In fact, the Goldstein electorate has more private health insurance policies than it does enrol voters. Now, that has a lot to do with the fact that we have a lot of international visitors who permanent residents who live in the electorate for professional reasons and the like. But we are very proud of our commitment to private health insurance. We have exceptional private hospitals and exceptional standards of quality of care because Goldstein residents understand the importance that if you want healthcare that reflects all stages of life without a race to the bottom, as the Labor Party would have, that a private health system not just enables them to have it, but frees up resources in the public system to improve outcomes for the rest of the community. And of course, there is no time, and it's more critical to talk about the necessity of quality healthcare than right now. And I say to all my fellow Victorians, through you, Speaker, how distressing it is that we witness another lockdown in the great state of Victoria. We, of course, had a number last year, particularly the very long one, which led to people being locked down in their homes for many months, and the human toll that that took, both in terms of physical health, mental health, and people not being able to live out their lives as usual. Through the great endeavours and effort of Victorians over a prolonged period of time, we got to a situation where we were able to eradicate COVID-19. Now, despite the constant celebrations of members opposite that they somehow claim this is a victory for the Victorian government, it was not. It was a victory for the people of Victoria and their sacrifice, not just to protect themselves and their families, though they did, not just to protect their communities, though they did, not just protect their fellow citizens in the state of Victoria, though they did. What it actually protected was the entirety of the Australian community so that they didn't have to go through similar measures, and we continue to be in a situation where Australia largely has been COVID-free throughout most of this pandemic. But the 25 cases and the multiple exposure sites in Victoria now bring back, I suspect, for many people, a form of PTSD back to that lockdown period and a fear about where we are heading and the measures that will be taken. And that's justified, Deputy Speaker, because people went through an arduous and difficult time last year. And if it's repeated, even if it's in a short period as we had in March, it raises questions about, again, the measures that are being taken by the state government, their efficacy for things like hotel quarantine and whether it's viable, etc. But I see what the members of the opposition have been complaining about in this discussion around health, which is somehow they think that the current outbreak in Victoria is the consequence of the Commonwealth. Now, I'm not disputing, as you know, the state acting Premier Molino wants to attack the federal government to avoid responsibility. I understand that the opposition wants to focus the energies on the Commonwealth and somehow blame us for what is happening in Victoria. And of course, they're free to engage in their shrill and hysterical commentary as they see fit. The reality is, as the previous member mentioned, the member for Oxley, that there are 3 million doses that have been spread out into the community of the vaccine. And of course, we want more Australians to get vaccinated. Make no mistake, whether you're in Victoria or any other state in the Commonwealth, you have a responsibility not just to yourself, but to your fellow citizens to get vaccinated. Because if you do not, we can risk every single gain we have had and put your family members and friends at risk. Yesterday, we had more than 104,000 doses administered. So there are always going to be a build-up to mass vaccination, and now we are very clearly at 100,000 a day driving an agenda for vaccinations across the community. But that doesn't mean that there aren't problems. I just got an SMS from a constituent talking about the fact that there are people being turned away from vaccination hubs in Sandown in Victoria. You just need to read the press, where a sick Melbourne boy was turned away 7 times from testing, I understand, yesterday, a state government testing facility. And in fact, there are reports yesterday that many people at 4:30 in the afternoon, so still within the working day, Deputy Speaker, still within the working day, people finished work, they took their responsibility, they went off to get tested at the Royal Exhibition Buildings in Melbourne, and they got turned away because they found the testing centre was closed, the one run by the Victorian state government. This is farcical that scenario has presented itself. You know, is it really too much to expect that testing centres are available and open to the community, understanding simple things like their need to go to work? Now, of course, people will be working increasingly from home over the coming week as we go into a 7-day lockdown, so that flexibility will be freed up. But surely somebody in the Victorian Department of Health could have said in the lead up to yesterday afternoon, why don't we keep the mass testing and vaccination centres that are available open, because we've just announced a number of cases and that Victorians might need to either get vaccinated or tested to fulfil their responsibility. It defies belief, but somehow, according to members of the opposition, that is the Commonwealth's fault. One of our biggest challenges, one of our biggest tasks, and it doesn't matter who we are, whatever side of this chamber we sit on, or within the rest of the community, is to take responsibility for encouraging people to get vaccinations. And Deputy Speaker, you would have seen the data from research that came out only the other day on the reasons for hesitancy amongst the community, because we as a Liberal government are not in favour of forcing things into people's bodies and compelling people to do things against their will. Certainly I'm not, as the member for Goldstein, as members will know. And it's a simple reason to go through and look at, well, why are Australians hesitant about the vaccine? 50% of people are afraid of the side effects. And of course, the concern that emerged out of the AstraZeneca vaccine earlier in the year. But we also need to be realists that the risks of COVID-19 and the spread and the health consequences that could come directly from that far outweighs any risk that Australians may experience from the potential side effects, which, by the way, are treatable from taking a particular vaccine, and particularly the AstraZeneca vaccine. Of course, the federal government has gone on to order substantial numbers of the Pfizer vaccine, the Moderna vaccine booster, so that those who need additional assistance can get it, and of course to make sure that people across different age and risk profiles can get a vaccine that's appropriate for them. But our responsibility is not, as the members in the opposition want to do, to constantly deride, attack, undermine, ridicule, and as the Prime Minister accurately reported yesterday, not focus on fighting the virus, but focus on fighting the government who are trying to get Australians vaccinated. It is actually to focus on what do we need to do to get Australians vaccinated. And that's where this government is and remains, while the opposition's position is to focus on trying to attack the government and fight the government. In the end, we're in one of these kind of Team Australia moments, and certainly in Team Victoria moments, where we actually need to rally together and work together in the hope that we can eliminate this, not just for the impact and success of the great state of Victoria, but frankly for the rest of the nation, because if there is mass exposure in Victoria, it will necessarily follow through to the rest of the country. But instead, what we're hearing from the opposition is simply a partisan Labor moment where they're interested in defending or arguing for themselves. And that's incredibly dispiriting and incredibly disappointing, because the people of Victoria, frankly, deserve better than that. And the people of Australia deserve better than that. What we need is a health system that makes sure that it can protect it and support people at times of risk and need. Now, we have complications at the state level. As I said, you have people being turned away from vaccination and testing centres in the state of Victoria despite their desperate efforts to do the right thing. We have Australians who are hesitant about the vaccine and the risks they feel to their health. And our job as leaders is surely to reassure them and to encourage them to take that responsibility. And my hope, Deputy Speaker, is that Labor members might for once transcend their desperate attempt at partisan rhetoric and focus on the mutual good of the Commonwealth and actually improve the health and welfare of the Australian community. Now, of course, we know that that has been something that has deprived them to date. We now face a choice in a moment, and we are at a critical moment, not just for Victoria but for the Commonwealth. That if we want to keep Australia COVID-free and reduce our exposure to the risks of the virus and the risks of transmission, that members of the opposition will stand up and support the government in its measures to do everything it can to get Australians vaccinated. And every alternative is merely partisan rhetoric and interest paraded as public
Debate
interest.
is interrupted in accordance with Standing Order 43. The debate may be resumed